I'm here today in Birmingham at the 7-day conference, which is talking about the future of the NHS and how we can move towards 7-day service, which is essential for our patients and for the future of the NHS.
It's a really exciting day and a great opportunity for providers and commissioners of healthcare from across England to come together.
My ambition is to address the deficiencies of our NHS, but to go that one step further and to make our NHS absolutely outstanding.
We've built a system, the mechanics of which are not compassionate, so they don't support the compassion that the 1.4 million people who work in our NHS feel towards those that they're trying to serve.
It is completely normal now to go shopping on a Sunday, not as an emergency but as a routine, and we have to aim to move our NHS services over 7 days as well.
Delivering 7-day services is something that is required across the whole of the NHS, and actually it's something that's been needed for such a long time.
There's times when I've finished work I may need an appointment after 6 o'clock. That's necessary for most people.
The benefits of moving 7-day service is that you're going to get the care when it's needed.
You have to think, if it's you or if it's your mum who comes into hospital at 10 o'clock on a Saturday night, that you can be confident that they're going to get the same level of care that they would get if they came in on a Tuesday morning.
I don't think it's right that people have different outcomes depending on what day of the week or what time of day or night they come into the service.
The way that we can most efficiently and effectively deliver services over 7 days a week is to get all those parts of those systems joined together. And that's absolutely vital.
I think we've got huge opportunities now with health, social care, the voluntary sector working together to really improve care.
A hospital can't deliver 7-day services on its own. It's got to involve the community, primary care and social services.
For a lot of people, GP services are their frontline services, and absolutely key that I think they have access to really good services 24 hours a day.
I believe that every person is entitled to be able to access the same high quality of care wherever and whoever they're registered with.
So the collaboration of different services, different organisations with the person in the driving seat who receives the care.
This is about ambition for our health service. It's about what our patients want.
One of the things that we've learned over the last year in particular is that how important it is to listen to your patients and then do something about it.
I would say that we've had patients involved across the planning of today and actively now want them to be very part of the whole engagement going forward. So they've been huge support as we've developed the programme.
I'm so proud of being a part of this today and being able to share my story. 7-day is a must.
Very often the specialists just don't work weekends, so the safety net isn't there really.
Patients expect us not to be constrained by what's happened in the past, but to think about what modern 21st century healthcare might look like for them.
Listening to patients and the public is going to be crucial for us to drive 7-day service forward.
It's got to be something that delivers for patients, but it's got to be right for staff as well.
I developed with my staff a new pattern of shift working so that it ensured their work-life balance.
I think it is about using the whole team appropriately to support patients.
Staff need their work-life balance as well as providing the right care. So if they get the right support as well, then they actually deliver better care.
There is something about following the money, but there's much more around wanting to produce a good quality service and being proud of that as an important part of it.
It will help me promote the idea of 7-day working to the organisation, but also working out where we need to target the improvement. It's just really powerful to listen to people who have managed to change things and how you can improve quality whilst looking after the finances.
There's a growing shift, an acknowledgement that we can't not do it.
We now have something to work towards within the NHS.
The NHS needs to be ambitious, it needs to be bold, it needs to really push the boundaries in terms of achieving 7-day services.
We've got to look at this with a fresh pair of eyes and really pull all the stops out to make this work.
I think we can and must deliver more for 7-day services.
We need to change and be effective and efficient for the future of the NHS so that we can survive and be stronger.
On the whole, our services are pretty good. But the point is, we can make them better.
If you want to get involved, contact us. We have details on the website, but we're more than happy to talk to any provider, any commissioner of services in any location across England.
Read all there is to do and just actively pick up the phone and say we want to be part of it.
Have a voice. Make this happen. because this is for everyone. Get involved, do it. It can affect you and your family, and you want the best for you and your family, so get out there and do it.
We have to have ambitions for improving the outcomes for our patients at the same time that demand is increasing. So that's a pretty complicated formula, and the variable in that formula is how we deliver our services, and that's what we've got to change.